YouTube channel.
Thank you. Okay, good morning, everyone. Here we are for our Professional Counseling Advisory Committee meeting for February. Let's go ahead and do our roll call. I don't have the roster here, but I think I have everybody in my brain.
Well, and Laura, if you'd like me to go through, I can do the roll
Would
call.
you please, since you have the list?
Absolutely.
Okay.
Okay. So when your name is called, just go ahead and indicate if you're present. Laura Shaughnessy.
Hello.
Jim Kilmartin.
Present.
There he is.
Harriet Bachner.
Good morning.
Melissa Briggs.
And we heard from her. She's not going to be here.
That's right. Michael Countryman.
Here.
Asha Gorath.
Gotcha.
Bob Kircher.
Here.
Vanessa Perez.
Present.
Andrew Secor, he indicated he would be arriving to the meeting a little bit late. And then Adil Torres Rivera.
Okay.
Welcome, everyone. And then we have a few guests. If you'd like to, why don't you go ahead and introduce yourself to the members of the committee?
Sure, I can start. I'm Callie Marino. I'm Vice President of Credentialing and Quality Assurance at MBCC.
I'm Dr. Umbra Ahmad. I'm the Director of Assessments at MBCC.
Good morning. I'm Tammy Lee. I'm the Vice President of CCE Business Services and Partnerships. Good to be with you this morning.
Okay, well, welcome everyone. And on behalf of the BSRB staff, my name is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. And I am present as well as the Assistant Director and Licensing Manager for the BSRB, Leslie Allen. So I'll read a brief comment about this meeting being conducted remotely. So public comment does allow the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or COMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. Time has been approved at this meeting for representatives from the National Board for Certified Counselors to provide information on the National Counselor Examination and the National Clinical Mental Health Counseling Examination and other related topics. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of COMA are not suspended, and we will be conducting this meeting pursuant to the COMA. On December 15th, 2023, we sent notice of the advisory committee meeting to all individuals that requested notice of such meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allow members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. We did check it before the meeting started, and there is no one currently on the conference call line. But if someone beeps over, Laura, I will let you know.
Thank you, David. Thank you so much. Okay, the first item that we need to address is the approval of the agenda for this meeting. Advisory committee members have received the agenda. Does anybody have any questions about it or any additions? And if not, I'll need a motion to approve the agenda.
Motion to approve.
Thank you, Jim.
Second.
Thank you, Bob. All in favor, say aye.
Aye.
Any opposed, same sign. Thank you. The agenda has been approved. And now we go to our presentation from our guests. David, do you want to go ahead and introduce them again?
Sure. We have three guests. In recent advisory committee meetings, the advisory committee has been talking about some of the licensing examinations for the professional counseling profession. And we had reached out to individuals to share more information about maybe just a little bit of the history of the examinations and maybe some of the reason why there are two different examinations and maybe some of the items that they cover and just some other topics relevant to those to help the advisory committee get a better understanding of the use of these examinations. And Kansas is a jurisdiction that does require passage of the examination for one level of license and then passage of the clinical level examination for the other level of license. And we spend most of our time talking about the laws and the requirements in Kansas, but Kansas is a little unique in terms of some states. Not all states have two different levels of permanent license for professional counseling. And so I think it'll be helpful to kind of hear from the individuals that are here with us today. And so with that, I'll go ahead and turn it over to you all. And I've enabled it. So if you want to share your screen, if you have any materials, you're welcome to do that as well.
Thank you so much. Dr. Ahmad is going to share her screen.
And before we jump into the presentation, I did just want to note for our staff who are taking minutes from the meeting, Andrew Secor has entered the meeting as well, so he is in attendance today too.
Well, first off, thank you so much for letting us come and share some information. We do have some basic information about the exam. Dr. Ahmad has also put together some data to share to hopefully help add any value to the conversations that you plan to have later. So we will get to that. So just to start off, so talking today about the National Counselor Exam, or the NCE, and the National Clinical Mental Health Counseling Exam, the NCMHCE, which we also call the clinical to make it a little easier as it rolls off the tongue. So if you can. David, you mentioned that you are unique in how you utilize the exam. We've put together a map here so you can see across all of the states that utilize our exam and districts. This is how it is used right now. We have a variety of states that just use the NCE, a variety that just accept the clinical exam, and then states like Kansas that utilize both, that require both exams for full licensure. And then we also have seen a growing increase in states that require either or. We've noticed the or states have increased, especially as counselors are moving and practicing in multiple states. So the or option has also become popular. Do you want to, there we go. And then so just a summary of what the exams are. So the National Counselor Exam, the purpose, it's going to measure the examinee's knowledge and understanding of the different theories, skills, and tenets that have been deemed necessary to practice safely and competently as an entry-level counselor. This purpose was established by a group of subject matter experts and decided upon based on a job analysis of over 16,000 counselors. It is a knowledge and understanding exam. So it is a very much a recall exam of the information. It is a 200-item multiple choice exam. Candidates get 3 hours and 45 minutes is the standard time to take this exam. And each item is standalone. No one item is dependent on any other item to get it correct. The clinical exam, its purpose is to measure a candidate's ability to apply and evaluate the knowledge. So as the NCE is knowledge and understanding, much more of a recall exam, the clinical is much more of an application, evaluation, and analysis exam. It measures, again, just like the NCE, the knowledge necessary to perform as a minimally competent counselor for safe and effective practice. It does so by assessing the clinical mental health counselor's ability to apply those theories, apply the skill-based tenets, establish a treatment plan, and it walks candidates through the life cycle of a client relationship. It is the exam consists of 11 different case studies. And over the course of the entire exam of those 11 case studies, it's going to have anywhere from 130 to 150 multiple choice questions. And they have the same amount of time for this exam, 3 hours and 45 minutes. And we have found that it's a much more intake, clinical application of knowledge. You probably could not pass this exam without the recall of knowledge and understanding needed in the NCE, but this is the application of that knowledge. Before we get into any data, are there questions from anyone about the differences in the exams, in their format? Okay. I will let Umber go to data.
So I did some data analysis for you all to kind of get a sense of what the national performance on these two exams looks like. Also how Kansas compares and their stats on these exams. And then I also did some investigation about the states that are requiring both examinations versus states that are anything but both. So either one or the other, or in that condition where they're accepting of either exam. So at a high level, Kansas statistics are on the left and the national statistics, and this is only subset to the data from last year. So this is January 1st of 23 through December 31st of 23. So what you can see is on average, Kansas is outperforming the national stats, about 4 to 5 points on the NCE and about 4-ish points on the clinical. I can go through the rest of the numbers, but any general questions there just kind of on baseline performance?
I have a question.
Sure.
This is Laura Shaughnessy. It's been a long time since I've taken the NCE. What's the pass? What do you need to pass?
So the NCE has multiple forms, and so the passing rate depends on which form of the examination you get.
Okay.
In general, there's 160 scored items, and the passing point tends to be somewhere between like the mid 80s to low 90s.
Okay, thank you.
Depends on the relative difficulty of the form you get.
Got it. Thank you.
Any other questions or anything you'd like me to walk you through here just with these numbers? Okay, so I have a visual representation of this to kind of help you look at it differently. So again, Kansas is in that kind of pink color. The national statistics, excluding Kansas from the national statistics, are in that teal color. So the part that is noteworthy is there's a slight shift with Kansas is a little bit further to the right than the national stats. That's showing that you have a higher mean there. You'll also see that section of the blue that doesn't have the pink underneath it. That shows that the lower end of the national stats is significantly lower than Kansas's lower end. So there's that place there where you're not seeing the overlap. That's where your candidates are kind of performing better than the lower end of the national stats. Any questions here? Okay. All right, so the next thing I have is kind of high level passing rates. And so you've got the NCE on the left and you've got the clinical on the right. The column that says both is an aggregate of all of the states that are currently requiring both examinations. And then where it says either is everything but both. So what we're seeing in the passing rates is that for the states that require both exams, the passing rate on the NCE, and again, this is just based on last year's data, is about 77%, which is about 6% higher than the states that take anything but both. And then for the clinical, that's an even more dramatic increase, closer to about 15 percentage points higher on the states that require both exams.
Dr. Ahmad?
Yes.
This is Laura Shaughnessy again. What is your professional opinion about the difference in those passing rates? Because when both are required.
Professional opinion about like the statistical significance of it? Oh, it's substantially significant. The stats are right underneath with the chi-square test there. Those are substantially different passing points.
Do you have an opinion as to why that is?
I could put in if you don't mind. My opinion, and again, this is a subjective opinion, but the states that require both typically are like Kansas in that the NCE is required for the entry, the first level of licensure. Then there is a requirement of experience, supervision, additional hours of work, because the clinical exam is intensely application based. The more experience you have as a counselor, naturally, the better you will do on an application based exam. So it makes, from a counselor perspective, that significant difference makes sense.
Great, thank you for that.
Other questions here on just kind of high level passing rates? Okay, so I'd ask you to sort of keep these numbers in mind, the 77 here for the NCE and, about 77 here for the clinical. As we move into the next slide, so this is looking at Kansas passing rates compared to the national passing rates. And again, this is just for last year's data. So on the NCE, the passing rate in Kansas was 88%, which is higher than the national passing rate, which was about 74%. And this is overall, which means this includes candidates that are retesting. So this is not just first-time testers, but this is every person who tested last year from Kansas and nationally. So there's a pretty stark difference there between Kansas and national stats for the NCE, and then again, an even more stark difference on the clinical with almost a 20% change there. And then if we just zoom in one step further, so now I'm going to subset just to the first-time test takers. The passing rate in Kansas last year was 91%. The national was closer to 76%. And then the passing rate for the clinical was 87%, and the national was about 68%. And I'm happy to walk through any of those numbers further if you'd like to, but overall, Kansas is outperforming the nation, and the passing rates are fairly substantially different for programs that require both, or for states that require both exams. And you can kind of see that's even more exaggerated in Kansas's results from last year's data. Any questions on any of the numbers, anything you'd like me to go back to? Okay. Well, that is everything that I had to share with you today. I think Callie and I are happy to answer any questions if you have any other questions about anything.
Great, thank you so much.
So I'll jump in with a question here too, and I'm not sure if you how closely you track this information, but as was mentioned, Kansas is a little unique in terms of having a level of permanent license below the clinical level that some individuals could stay at for their entire career. And I know that there are probably some other states out there that have more than one level of permanent license, but it's a bit more rare. Do you know about how many states have multiple like tiered licensure like we do for the professional counseling? That are kind of like set up the way that we have it, where we have a requirement of passage of the one test for the lower level and then the clinical level for the higher level?
I'm not 100% positive on this, but I do know the ones that have the and, so the yellow states, they have the tiered licensure that require both. To my knowledge, and Tammy, you might know this more, but I think Kansas and Ohio are the only ones that you can stay at that first level forever if you want to. Most of the other states that are and that first level, there is a time limit on it to get the second permanent licensure. Typically, it's anywhere from 2 to 4 years to get that additional experience and supervision requirement to need to go to the next level. Tammy, do you know if there's any others other than?
That is correct. There's a couple of more states that, they allow them to stay there, but for the most part, they are, like Kelly quoted, there's 2 to 4 years where you must go ahead and obtain that higher level.
And I know that there are some states that have a requirement of one or the other. And I guess we have just a small number of states that require only the clinical level of examination. Do you know how long have both of these tests existed? I'm just kind of curious if we've had these in place for many, many years, or if one was developed after the other one. So.
Yeah, the NCE was developed in 1983, and the clinical was in 1996. So it's been a while that they've both been around. As far as licensure is concerned, Tammy might be better to speak to that one, is when states started adopting the clinical exam for licensure purposes. Early 2000s, I believe.
It's early 2000s, and because some of the states have their own tests, so they were given their own, and so they kind of adapted. So whenever NBCC created the clinical, that's when we start contracting with the states to take our national exam. But the other states, such as California, they have their own, and still do have their own oral exam that they have to take along with. 'Cause they only accept the clinical exam, but they have their own oral exam as well that they have to take.
The clinical exam was developed initially in the 90s as the exam requirement for the NBCC's national certification for clinical counselors. And it was successful. The data was proving to be very demonstrative of a clinical counselor's experience and competency. And that's when states started reaching out to us about using it to replace their own exam.
Okay, thank you.
What else can we answer?
And I don't know that you have this data because some of this could be a little tricky to quantify. But I guess one thing that they might ask us, right now we have our legislative session in Kansas, and sometimes they're looking at requirements for licensure and they're questioning the need for different things. And they might ask us, the value of having certain requirements, and does it lead to more professional practice or less violations from individuals who've demonstrated competencies in certain ways. And I don't know if this exists, but if it does, figured I would go ahead and ask if you're aware of any data that kind of shows, individuals who have showed competency in this way are more likely to be successful practitioners or more likely to avoid disciplinary issues. But just thought I would ask to see if you're aware of anything like that.
We unfortunately, that data is really hard to get. So Umber and I have had a lot of back and forth conversations about how we could collect it. A lot of what would come in a typical professional sort of analysis that you would do is you would reach out to whoever the stakeholders are for those counselors. Well, those are clients, and we can't violate all kinds of confidentiality, ethical codes and laws in order to do that. And so that is not something we've been able to do. As far as the ethics piece, unfortunately, at the state level, we do not have access to all of that information. So we haven't done that. We've started to look at how we can collect it with the NCC's ethical data, but it's only conversations at this point. What I can say is that the fact that Kansas's numbers, as well as the other states that require both exams, just the scores alone on the exams are, for those states that require both, being so drastically higher, is evidence that the counselors in those states are getting the training that they need in order to meet the requirements of the profession. The test score is only one piece of the puzzle, and thinking about all of the accredited schools in the state and in the area, the different options of supervisors that are available to these counselors. They all contribute to the bigger picture, and the exam is a good data representation of that.
Well, and I know this is also part of the equation too, that states have a certain amount of jurisdictional authority over what is actually an unprofessional conduct violation as well. Our advisory committee has spent parts of the last 2 years reviewing our state's unprofessional conduct regulation just for the professional counseling profession, and it's not always apples to apples from one state to another.
It's tricky. Yeah.
So, yeah, it's a complicated thing, but in case it was something that you were aware was out there, I thought I would just ask about it.
No, I will tell you, the conversations are happening. We just haven't quite figured out how to make it happen. So we're trying.
Yeah. And from us, we're a composite board, so we oversee 7 different professions. And one of the professions we oversee or regulate in Kansas is social work. We put out a survey for social workers back at the end of 2021, I believe, and just asked them a number of questions about a number of different topics. But one of those had to do with any issues they saw, particularly in the area of supervision. And it wasn't wide to cover all areas of professional experience, but We are in the process right now. We just released on Friday a survey for social workers again to identify some issues regarding things like telehealth and supervision, and just trying to get an idea of what issues are currently out there. And so we're starting to collect that data, at least in a qualitative way. And potentially we might have some more information for other professions in the future, but thought I would let you know about that. And we should have that survey concluded probably by the 10th. And then we're hoping to put a report on our website. So I know it's a different profession, but there are some similarities in the mental health profession.
Yeah.
I would make you aware of
No,
it.
that's excellent. No, I'd love to see the, I'll definitely check in. I'd love to see the results.
Great. So sorry, members of the advisory committee. I had a few questions, but I don't want to deter you from asking questions. So if you do have any additional questions, feel free to ask them now.
I do have a question. Just curious. So if I'm correct, right, this is the first year where the format of the clinical exam is different. I think that did happen, right? Where the
Yes,
format
it was
kind of changed.
just before this. Yeah, it officially changed in October of 22.
Oh, okay.
Last year was the first full year of data.
Okay, I'm behind. That's yes. So I was curious, kind of looking at the data, like what was kind of the reasoning behind changing the format of the exam? Like, was just curious, the thoughts behind it.
The main reason was accessibility. The previous exam, for lack of a better word, was a little clunky. It made it really difficult for our test provider, for our test partners to be able to provide the accommodations needed for our candidates. Just the way it was built just made it really hard for certain, especially our visually impaired candidates or any candidate that had any other kind of learning challenge. And the paper and pencil version of it was even clunkier. So that was the driving force, was accommodations. The other pieces, some of that clunkiness made it a little more about the candidate's ability to take a test versus the candidate's ability to understand and apply the knowledge. And so the new version is much more it much more resembles what a counselor actually does in their clinical practice. And it was a good 2 years of development, and then of developing the format, and then 2 years of actual content development that went into it. So we are seeing a definite positive impact of those changes, especially in the areas of accommodations.
Thank you.
And Callie, on the new exam, does it have a high emphasis on diagnosis? Did they keep that in there?
Yes, it is. The new exam is a little different in that we give the diagnosis, but the questions, you have to be able to know how we got there in order to answer the questions right. The previous exam, by not giving the diagnosis, we got a lot of appeals on sort of the art versus the science of diagnosing. This takes that question out of it. We give the diagnosis, and it might not always be right in the case. You have to determine based on the questions, based on who the client is, based on their sociocultural background, based on their familial history, and the current treatment plan that's sort of put in place in the exam, if it is the correct diagnosis, and what kind of co-occurring diagnoses there might also be.
Any other questions for our guests, members of the committee? Well, I don't see any other hands raised or any questions, but really appreciate the three of you attending our meeting today to share this information and answer questions. Very valuable information. One of the things that our board does is to assist the work of the board. Since there's 7 professions, these standing advisory committees are really helpful to the work of the board. Most of the members of these advisory committees are licensed professionals, and there are board members on these committees as well, but the recommendations that this committee makes are forwarded to the board, and the board can take action. So, but on a profession by profession basis, this is basically where a lot of the work gets done in terms of the specific profession. So I really appreciate you all volunteering your time to attend this meeting and share the information with us.
And our email address was in the slides. David, I know you also have our email addresses. So if anybody has any questions later, or you think of something you need clarification on, please do not hesitate to reach out to either myself or Dr. Maude. We're happy to answer any of those for the committee.
Thank you so much.
Thank you.
Please don't feel the need to attend the rest of the meeting on the Zoom. If you'd like to watch the YouTube channel, that's broadcasting now. It's available afterwards, but really appreciate your comments today. And I will follow up with you if we do get additional questions after the meeting as well.
Thank you. Have a good day.
Great presentation, good information. Okay, let's continue. The approval of the minutes from the December advisory committee is our next agenda item. You all received your meeting notes in your packet. If there are any questions or changes, please let us know now. And if not, I need a motion to approve these minutes.
So moved.
Thank you, Michael. I need a second.
I second.
Who was that? Harriet?
Vanessa.
No. Vanessa. Thank you, Vanessa, for a second. All in favor of adopting the minutes from the December meeting, please say aye.
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 Any opposed, same sign. Okay, the minutes have been approved. Thank you so much. Okay, next thing, David Fye, Executive Director's Report.
Thank you, Laura. I'll
Thank
give some
you.
updates on BSRB operations, a few items from the most recent board meeting on January 12th, and then some legislative items of note. Starting with operations. So one thing the state is focusing on and has started focusing on more intently in the last year is some contingency planning. And so there was a direction by the governor's office last year that agencies under the executive branch would need to put together a very detailed continuity of operations plan. And so we worked with the Department of Emergency Management to put that into place. It was not something where you put together a short report. It actually was an in-depth process where you have to list a lot of information. You know, should you have an unexpected emergency where you would have to relocate staff, have necessary resources to essentially do the work of the agency from different locations. And it was a really interesting process. And so we do have that in place that has been approved. We're probably going to work on it a little bit more this year to add some items to it, but that is something they have been putting in place. Additionally, last year, there were some efforts to increase IT security for a lot of state agencies and doing some audits to do checks to make sure that agencies were taking appropriate action and have good things in place. And then also building security. I've been a part of a few meetings recently on behalf of the agency where they have been looking to say, you know, how can we make our physical structures more secure? And so there are a number of physical changes and then work behind the scenes that is being done as well. So all of these are really positive changes. They do cause some additional work in terms of the operations of the agency, but definitely worth our time to be a good player in that process. And so so a lot of that is going on behind the scenes, but then again, it's funny. I was attending some of these meetings and I was talking about, you know, we want to be good partners in this process too. And they said, you know, we set up in a liaison process. We'll be communicating with agencies. But some of the things behind the scenes you may never see. And just for security reasons, some of these things are helpful just if very few people know about them. So I probably won't spotlight a ton of these topics. I just want to let you know behind the scenes, there's some good work that's being done and some real positive changes. Another item with operations I want to make you aware of, I mentioned during the presentation that there is a social work survey. The social work profession had requested, the advisory committee had requested drafting of this survey. It's 14 questions. It was sent out to all, I believe, 8,292 currently licensed social workers in the state of Kansas. And we are hoping to have that open for about a week. So we'll be collecting feedback. And that survey does ask some questions about specifically telehealth supervision. It also asks some questions about their licensing examinations as well. There is currently an item for a multi-state compact for the social work profession. So there's a number of topics relevant to their profession. And they did a survey that was similar a few years back that asked about some other topics, but they wanted to have some more recent information, and some of these were new issues as well. For your committee, I did want to let you know that I think collecting this information is valuable. Not to say that the board should be swayed just by what majority opinion is, but collecting some of the feedback can be helpful, and some of the qualitative information that's collected in terms of issues can point to items to be addressed or focused on. And so if your advisory committee would want to do a similar survey, we do have the ability to do that this year for this professional counseling profession. So one item we were able to get was the ability to do a survey and collect responses back from 15,000 individuals. And so I think with that, we're able to do probably one survey for each of the professions this year, if the professions would like to do that. So something to keep in mind as we're working through topics this year, but that is a resource we were able to obtain. Another item, we are working on a process for scanning some of our documents here in the office. We're trying to make the transition between having a lot of paper records to having fewer paper, and then of what paper we need, scanning them and turning them into electronic documents rather than paper. But we don't have approval yet to make a full transition. We're trying to make sure that we have a good process set up to have good scans and have basically a way to check to verify that we do have the process down, and then we'll be able to go in front of a committee with the Historical Society and ask for a change in that process. So if we are all set up and our testing is completed by the end or by sometime in March, we could make that request then, if not sometime in the future. And then the other operations update, I'll just let you know about. Leslie Allen and I have been contacting and have been contacted by a lot of schools to request presentations. We typically do present information to different groups of schools that educate for the professions that we license. And we have done a lot of these the last few years over Zoom because of schedules and also because of the pandemic. Now that we are moving to a better place with all of that, I'm really trying to make an effort as much as possible that if we can present to these schools in person, really trying to do that, trying to build more good relationships with the individuals at those institutions, trying to understand some of things that they're discussing, and then connect more in person with some of those individuals. So we have a number of those that have already been put on our calendar for the spring, and hoping to put even more dates on there as well. Now, maybe some of them will still need to be by Zoom based on legislative meetings that can sometimes come out of nowhere, but really hoping to connect more this year and then in future years with some of the schools. And so that's something we're working on as well. In terms of turning to some items from the past board meeting, the past board meeting took place on January 12th, 2024. There was public comment from Tanya Rickliff, who is the board president from NASW Kansas, National Association of Social Workers in Kansas. She requested support for a bill on the Social Work Multi-State Compact if that bill was offered this legislative session. And this is something the board had received a recommendation from the Social Work Advisory Committee also to support the legislation on the compact if it came forward. And so the board did discuss the Social Work Compact legislation at that meeting, and the board decided to support the legislation if it came forward in bill form, and it has, as House Bill 2484. But the board knew that there would be some issues that would need to be resolved. The two main issues is that the Social Work Compact is structured differently than some of the other compacts. And one of the main differences is that the Social Work Compact would basically allow states to start offering a new type of license. So right now, every state has jurisdiction to basically determine the requirements for someone to practice in that state. And so if you want to practice in Kansas or provide services to clients that are located in Kansas right now, you generally need to get a license in Kansas, or you could do a short-term out-of-state temporary permit. But most people, even if they're from another state, would need to get a license in Kansas to provide ongoing services, either physically here or by telehealth. And most states are set up that same way. What has happened is that for a number of the mental health professions, it has led individuals that travel frequently or do a lot of telehealth to start collecting licenses. And so some individuals have licenses in many different states. Well, to provide an alternative to that and replace that model, the social work multi-state compact would say you can if you pass the compact and you become a member of the compact, and once it's operational, your state will be able to continue to issue your current licenses, which I'll refer to as single state license. And that will let you practice wherever your state you're in, or you can get a multi-state license from your home state. And so the home state multi-state license will let you practice in that state and in all other member states of that compact. And so instead of having 5, 7, 10 licenses in different jurisdictions and having to juggle all the continuing education for all those professions, for all those states, you would just need to get a multi-state license in your home state, pay the appropriate fee, and then you would be able to meet those continuing education requirements. But if you traveled to those states, you could practice there. If you did telehealth into those states, you could do that as well. The complicating thing, currently right now in Kansas, there's about 8,292 social workers that are licensed by the BSRB. About 1,784 of those individuals live outside of the state of Kansas. So under this model, if states did join this multi-state compact, in terms of our license totals, the state of Kansas, those totals would drop by about 1,700 to 1,800 people. Because there would be no reason for them to continue to get the Kansas license. It would probably be more effective for them to get a license, a multi-state license in their home state. However, this loss of revenue in terms of license renewal fees from 1,800 people would essentially cause a loss of revenue every 2 years of about $150,000. So the way to make up for that is to charge a higher fee for the multi-state license. And so individuals would no longer have to get all the different licenses, but the fee for just practicing in your own state wouldn't change. But if you wanted to get a multi-state license and practice in other states, then that's a way that the state could make up for the lost revenue for individuals living outside the state, for those individuals who would no longer be getting the license in Kansas. And so there's also a requirement under the compact that individuals practicing under the compact would have to have had a criminal background check with fingerprinting, and that is not currently something the BSRB requires for licensure, but those two issues would really need to be resolved. And the compact legislation, House Bill 2484, does currently include a statute for the BSRB social work license fees, and it includes the cap that they cannot go above. But the BSRB could potentially set the amount for the multi-state licenses. As long as they're under the cap, they could put a higher amount for the multi-state licenses if that bill passes, the compact becomes effective, and that would be a way to kind of adjust for the potential loss of revenue. So I'll pause there for a second. And I think, Michael, you have your hand up. Do you have a question on that?
Yeah, David, I was wondering, is there any way for us to track how many licensees are dual licensed from other states practicing in Kansas? For example, you said we have over 1,000 practicing elsewhere. What about individuals coming here and practicing? Do we know what that number is?
We don't. So in our license system, we keep track of individuals' residence for where they live, and then also their business address. So we have a general idea of how many individuals are licensed here but live out of state. In terms of individuals who practice in lots of different states, we just don't really have that information. I've heard from individuals who say, I practice in these 7 or these 10 states and I have all these licenses, but that currently right now, at least to my knowledge, I'm not sure anybody's tracking that. So.
Okay.
And I think, this is what's tricky is there has been a hearing for the social work compact bill, and the members of the legislature, I think as much as possible, want to understand these terms and understand the differences. But one thing that is different between the social work compact versus, let's say, the professional counseling multi-state compact is that the professional counseling multi-state compact is set up so that once it's operational, individuals who want to practice in other jurisdictions would essentially try to get a privilege to practice in those jurisdictions. And it wouldn't be the same thing as licensure, but it would function in a similar way. And each time one of those privileges to practice is issued, there would be an opportunity for those states to charge a fee for the privilege to practice in those states. And that would be a way for the states to make up if individuals wanted to do a privilege versus traditional state licensure. So that's kind of one of the main differences. And I think for the social work compact, this really would fundamentally change state licensure. So it is set up very different than the other compacts that have come before it. And so this has kind of been a topic of conversation. As I mentioned, there was a hearing, but the committee has not worked the bill yet. They have not put on any amendments yet. And honestly, the language of the compact really has to be passed in identical form. The specific language for the multi-state compact, but you can add items to do with fees after the compact as a way for states to kind of balance revenue and account for membership in compacts and things like that. So there is ways to do that. You just can't change the terms of the compact. And Andrew, I saw you had your hand up. Do you have a question?
Yeah, thank you. So I'm curious to see how this, I guess, what your thoughts about how this plays out, because this is one of the issues that I know it was run into, that this idea of state boards, that's why we went away from portability, is because states did not want to open their statutes up to changing how licensure could look. And so that's why the compact and privilege system was explored, and ultimately what we went with. The board supporting this idea? I was curious to understand a little bit about the board's thoughts behind supporting this, knowing what possibly this could do to the BSRB, as well as recognizing this is quite different than what the rest of our compacts do, why the board chose to support this, and what the general perception is of what you got from being at the committee hearings surrounding this particular topic.
Yeah, so I think there is a lot of support for this compact from what I have heard, and I think that most states will pass it. I was definitely, Kansas was not a member of the drafting committee, and we didn't have a voice in terms of the terms that were put into place in this. I think one of the unfortunate things is that these compacts are all situated a little bit differently, and I think if they were situated more similarly, it would be helpful for everyone involved. But I think with this situation, I think there was an understanding that, and we were contacted by representatives from NASW Kansas early in the process, who basically said, would the board support this? And I said, well, your best way to know that would be to come to a board meeting. In the past, individuals that were supporting other compacts have approached the board and requested support, and so that's what they did. But I said, one of the big issues here that I think needs to be resolved is this potential loss of fee revenue from licenses, and there are quite a few individuals that live out of state that choose to get a Kansas license, and if this passed and their states join the compact, that license revenue would go away. Those individuals most likely would do the multi-state license in their home state. And so, but now we're getting a little bit of pushback. And I think that still will need to be resolved. I think one of the big questions is how much to set the multi-state license amount at. And I think that should somewhat be driven by interest in the multi-state license, and also making sure that we balance our revenue as well. So as I mentioned, it's estimated that we would lose that, if all the individuals who currently get the Kansas license were to drop off the rolls, it would be a hit for them not renewing their license of $150,000 spread over 2 years. And so, but there are more people that are licensed here in Kansas that live here than individuals that live outside the state. And so if there's 8,200 and let's say 92 social workers in total, and about 20-something% live outside of Kansas. If you have a lot of individuals here that would want to switch from the single state license to the multi-state license, you don't have to have it be double the license fee. You could have it be a smaller amount and then still balance that out. So part of the survey is trying to get interest and trying to see who would be interested in switching. And then once we have more data on that, then the board could take a look and say, okay, well, the multi-state license should be at this price point, or at least the renewal fee, to make up for some of that lost revenue.
And David, what if, and you may have already answered this, but what if the clinician is providing televideo services to somebody else in one of those states that's part of the compact? Would they still need to have that multi-state licensure?
So right now, whether you're doing in-person services to someone located in Kansas or telehealth services to somebody, you need to have authorization to practice in Kansas. And so for most of the professions, that would require licensure at this point. And the reason I kind of qualify it that way, the psychology compact that we joined, SciPac, there is a way to apply to specifically do telehealth in the other compact states. So that one is, the SciPac one is a little bit different too, because it's not full licensure and it's a limited scope in terms of how you're practicing. And so you can apply through SciPac to either just do telehealth in other compact states or to do a limited number of days of in-state practice. I think it's 30 for the course of a year. That one is situated very differently too than the professional counseling or through the social work. But the social work one is set up where if you do pass the compact legislation, the compact becomes effective, you would essentially be able to travel to those other states and practice in those states or do telehealth between those states that you have a multi-state license with. Now, if those states don't join the compact, then you would need to meet whatever requirements those states have to do that. But under the social work model, if let's say 30 states join the social work compact and you get a multi-state license in Kansas, you would be able to do in-person or services by telehealth in those other compact states. So yeah,
I guess I just wondered if maybe supplementing income, that it might be more attractive to individuals to have that multi-state licensure if they're able to practice televideo outside the state. Just an idea I was thinking about.
Mm-hmm. Yeah. And some of the ones that do allow, televideo in other states or telehealth, like for SciPac, it does allow you to do telehealth and televideo in other states, but you have to be physically in your home state at the time you are doing those services. So,
Right.
Even if you do travel to another compact state, if you have not switched to your home state, you're still not able to do the televideo between states unless you're physically in your home state. So there's a lot of unique requirements for the different compacts. But that social work compact, I think we need to determine what the appropriate amount would be for fees to kind of make up for some of the lost projected revenue. The criminal background check requirement is something we've seen consistent for these professions, and so that item will have to be addressed too. And so that's something the board will have to take a look at and determine. Also from the board meeting, there was a report back. Your advisory committee had discussed the topic of individuals providing supervision. There had been a question, currently right now, most supervision for professionals is provided by members of their own profession. And there is language in the existing regulations that would allow someone from another profession to provide supervision for professional counseling or marriage and family therapy. But it does call for there to be extenuating circumstances, which is a term that is defined in the regulation as an extreme situation that would cause an individual to be unable to meet the requirements or make it inadvisable for them to do that. And as we've discussed in a few meetings, that's a very high bar. Ultimately, the professional counseling profession and the marriage and family therapy profession, there were discussions by both advisory committees, and the consensus was to leave the existing language as it is, because there was still a strong preference that members of those professions would be the one providing supervision. But in an extreme situation, both professions thought it would be helpful to allow there to be a little bit of latitude under an extreme case, but in general, for the supervision to be provided by members of that own profession. Additionally, the board is moving forward with an agreement with a company called CE Broker to assist with tracking of continuing education hours and to assist with the auditing process when individuals are audited right now. When individuals renew their license, 10% of individuals are audited. What this company would do, it would provide a free service to the state of Kansas, and it would provide a free service to individual licensees. So you could you wouldn't be required to do this, but once the agreement's in place, you would have the ability to set up an account with CE Broker, and then as you accrue hours of continuing education for your renewal, you would be able to upload the documentation, designate the documentation satisfies the 3 hours of ethics or the 3 hours of diagnosis or 6 hours of diagnosis and treatment, or the other hours toward what hours you need for your renewal. And so that way it would be a place where you could keep those records without having to keep stacks of paper. And then if you are audited, there could be a check to see, do you have those things in place? And then the BSRB would be able to pull that up and review those records much more easily than having to send stuff back and forth or mail stuff back and forth. We're working on some of the logistics behind that. And one of the items too that we started to have a conversation of currently right now, if you renew a professional license, as part of that process, you sign an attestation that says at the time that I'm renewing, I have completed all of my hours. And even if there's more time left in that license period, you have to basically have your hours completed at the time that you renew. One of the services that CE Broker could provide would be to say, if you are renewing your license and you're selected for audit, or let's say that we changed that too, but we'll get to that a little bit. Let's say that you renew your license, they do a check to look to see, have you completed all of your hours? They could send you a notification under a certain scenario to say, you said that you completed all of your hours. We did a check of what you have in our system and we think you may be insufficient, but here are some opportunities to take those hours. And they have a list of CE classes that they are aware of, CE providers. That's not currently something that would be very beneficial to our licensees, because right now, if someone goes to renew their license, does the attestation that their hours are complete, there's really not a way for them to make up hours after that point. However, there are other licensing groups, like let's say, for example, I'm an attorney and I have to renew my license in the legal field every year, and I have to get a certain number of continuing education hours. And I am asked to renew my license about a month or a little longer in advance of my expiration date. But I don't have to have all my hours by that time. I still have up until my license expires to finish my hours. So one thing that we could have the board consider would be to say, in the future, under this scenario, you could look at something where it would say at the time that you renew your license, you are attesting that you will complete your hours by your expiration date. And then if there is an issue, potentially CE Broker could let you know, we've done a check of our system. We see that you may be insufficient, but there's still 2 weeks left in your time period. So maybe you can get those hours. And so that would take us putting forward some changes to our existing processes, but that may be something beneficial for everyone involved. One of the benefits too is it could potentially reduce the number of disciplinary issues. Some individuals do apply for renewal and then they say they have all their hours, and then when they're selected for audit, they don't have all their hours, and that usually does result in a penalty. But under this scenario, it could help people if we were to adjust some of that process so people could get some additional hours before their license expires, which is really the intention. You want people to do the continuing education. You don't want them to run into disciplinary issues. And so it would take a little bit of logistics, but that's something we're currently working on in terms of this implementation process. Another item we're kind of working on from that board meeting is right now, when we have individuals apply from non-accredited schools, we have experts sometimes that we bring in to look at the coursework or the program level requirements. In the past, whenever we've utilized an expert, all of those items have had to come before the board to receive official board confirmation to go ahead and license those individuals. But in some situations, we get the report back from the board. Leslie and I review the information and we say, this seems to be sufficient. Everything is very clear. There's no more remaining items, but we have still continued to take those before the board to make sure the board was the one expressing their support for this. And so at the last board meeting, the board did a delegation motion that basically said, if we utilize an expert and the information we comes back supports this person, would be good to move forward, and there are no more remaining items for the board to review, we can move that person forward in the process without it having to be held for the full board to review it again. So we're able to move forward on some of those individual cases a little bit quicker more. So really happy about that. And then one item that the board is exploring as well, there's a company called Acela, and they have been selected as the vendor for the state's new enterprise licensing system. There was a bill that was passed last year to make a unified license verification portal for the state for professional licenses. And as part of that process, they were going to be setting up a license system for any state agencies that wanted to switch to that new provider. And I've been collecting information and kind of tracking this, but we have not made a decision, and the board has not received information from that vendor to see if the board would want to make a switch from our existing license platform to this new setup. So at the board meeting in March, the board will get a presentation from this vendor and then be able to ask them questions and see if it would make sense for the BSRB to consider moving from our existing license system to this new vendor. And then just want to highlight a few items in terms of legislative updates. Every year, the BSRB's budget does have to be reviewed by both the House and the Senate separately. In terms of the Senate review, our budget was reviewed by the Senate Transportation and Ethics Committee. They had some good questions on updates and things that we've been doing. They were complimentary of the agency, and we told them, you know, we are set up basically to operate at a deficit because the board lowered a lot of license renewal fees back in 2019 as a way to draw down our ending balance, and that we are going to have that go down for a period of years. And then at a certain point, we will need to readjust fees to make sure that we have an equilibrium. But compared this year versus last year, the balance in the BSRB fee fund is $143,000 lower from this time last year to this time today. So the amount in the fee fund is going down, but we have about $2 million currently in the fund. Our budget is a little over $1 million every year. So we'll still be able to do this going forward for the next few years, as long as we don't have any unusual expenses or something unusual doesn't happen like the pandemic. So the Senate said no recommended changes, governor's recommendation for the amount, and that is moving forward. The next step will be for the Senate Ways and Means Committee to report out, as what they call it, and that's when the chair or a member, the chair designates, makes the full report to the Senate Ways and Means Committee and basically says, we reviewed their budget. Our recommendation is the governor's recommendation for expenditures for fiscal year 24 and 25 with no other changes. So that is what the Senate has agreed to. The House, we are heard by the House Higher Education Budget Committee. The Budget Committee reviewed our revised estimates for fiscal year 24 and 25. The Budget Committee didn't have any recommended changes for the dollar amount, but it did express some concern that the balance in the BSRB fee fund was too high. Now, we did provide the same information that the board had lowered fees back in 2019 with renewals. The board actually also lowered fees last year for some of the temporary licenses. And we indicated that we had absorbed the cost of also 2 licensing specialists that were approved by the legislature last year, so that we could draw down the balance over time and then reevaluate. But they still expressed concern, and their recommendation was for the BSRB to provide a report back to their committee by February 29th with a plan to possibly lower fees an additional amount to draw down the ending balance in the fee fund more quickly. So that is something that we'll be working on. I've reached out to the chair of the board. We had a conversation about the recommendation. We have scheduled a special board meeting. So the board will be meeting next week on Monday, February 12th, just for a brief 1-hour meeting from 8 to 9 to have a conversation about the budget committee recommendations and then other items relevant to that, so that we can be compliant with the budget committee's request for the report. And we can discuss where the fees currently are, a little bit of a history of the fees. You know, it is not our intention to want to raise fees to any licensees, and the longer we can go without doing that, the better. You know, this is something that the budget committee had comments on, and I think the board will need to have a conversation to, you know, how best to address these concerns. So that's something coming up. Another item, we have talked about some of the changes to regulations for the profession, and that process can take some time. We have had a set of regulations that has been in the works to be changed that had to do with a lot of recommended changes your committee discussed with the in-residence requirements for some of the educational standards. That set of regulations has gone back and forth between the Department of Administration, the Attorney General's office. There have been some recommended changes when it was reviewed by both entities and it had to be resubmitted. Recently, we got approval for 11 regulations to be open for public comment. So even though this was not all the ones that were being reviewed, we thought, let's just go ahead and take what we can and open this up, because some of this will help us be able to license more individuals to meet these different requirements. And so, so we were able to open that up. It was published in the Secretary of State's publication, the Kansas Register, on January 25th. As part of that process, it's held open for 60 days for public comment. There's also a note about this on the front page of the BSRB website. And at the end of the 60 days, agencies are asked to do a public hearing. And so that public hearing is at the BSRB office on Tuesday, March 26th. It's an hour long. That is generally what we have done for the official public hearing. And the individuals are able to submit comments electronically, though it doesn't have to be just on that one day. But that is the official date. And then after that date of March 26th, individual will be able to have the board discuss any feedback we've received, and then the board will need to take an official roll call vote. And then after that point, we'll need to have the final version published in the Kansas Register. And then I think about 15 days after that, they become official. So it's a very methodical process, but we're moving closer, and being able to open them up for public comment was a big step. So happy about that. Leslie and I appeared in front of a legislative committee this past Friday on February 2nd. It was the Joint Committee on Administrative Rules and Regulations, and that's a joint committee of the legislature. And we explained the changes to the regulations. They had several questions. So some of that feedback from that committee will also be provided to the board. But we did let the committee know that some of these changes, we are attempting to examine the requirements for licensure, especially from individuals who come from non-accredited schools, and trying to see if those requirements are still necessary, what are helpful changes to modernize, and then what is still necessary for the public protection mission of the board. Ultimately, the board was created to protect the public, and it's important that we do have good license standards to make sure that vulnerable populations do get assistance from individuals that are properly educated and properly trained. So that is, we have requirements in place for a good reason, but that doesn't mean that we can't have conversations and continue to look to adjust some of these items. So again, I'll let you know when those do go into effect. And last year in October, we had a special meeting for educators and also one for employers, where we talked about some changes in the statutes over the past few years. And those meetings were well received. I got a lot of good positive feedback from that. I said at that time that I don't intend this to be a one-time informational forum, that I would like there to be more conversations like this. And so I think probably when these regulations are made permanent, this would be another good opportunity for us to host a similar forum. I did mention last time that focused on the changes to statutes, but there have been a number of changes to regulations as well. And so both are important. And so this might be another good topic for this year to set up some meetings with different groups and then talk about some of the changes to regulations to make sure that everyone is on the same page with what is currently required. And then I'll go briefly through some items here. I'm not going to go into a lot of detail, but I know that some of you do try to follow legislative activity. And so I'll just highlight a few bills and I'll tell you the names of the committees. I do not have a lot of detail on most of these bills, but if you see or if you hear a bill that you think would be interesting, the legislative website is a real good resource to be able to pull up this information. And as well, the legislature does have a YouTube channel, and the meetings are all broadcast now. You could go back and listen to any of these hearings and hear the discussion. So I'll just highlight a few bills that you may want to look up. There is a bill, it's House Bill, there's a bill that involves mental, emotional, and behavioral health treatment of medical services that may be provided to a child alleged or adjudicated to be a child in need of care. That is House Bill 2580, and it did receive a hearing on Wednesday, January 31st in the House Child Welfare and Foster Care Committee. There was a bill that would expand the definition of peer support counseling session and the rules of evidence. That was House Bill 2557. It was heard on January 30th in the House Judiciary Committee. There was a bill on providing and programs and treatments that are provided at certified community mental health clinics be granted a renewal certification if such programs and treatments have previously been certified or accredited. That was House Bill 2578, and it received a hearing on January 30th in the House Health and Human Services Committee. There was a bill that would require the Secretary of the Department for Aging and Disability Services to reimburse counties for certain costs when a person in a county jail is awaiting examination, evaluation, or treatment for competency or other provisions in jails. That is Senate Bill 228, and it received a hearing on January 30th in the Senate Judiciary Committee. There is a bill that would add for-profit entities to the definition of a qualified applicant in the Kansas Fights Addiction Act, and that is Senate Bill 307, and it received a hearing on Tuesday, January 30th in the House Appropriations Committee. I mentioned the Social Work Compact Bill. That is House Bill 2484. It received a hearing on January 23rd in the House Health and Human Services Committee. There is a bill that would codify the Mental Health Intervention Team program that's administered by the Kansas Department for Aging and Disability Services in state statute. That is House Bill 2669, and it received a hearing or will have a hearing on February 8th in the House Health and Human Services Committee. There is a bill that would create a statewide drug abuse resistance education or DARE program educator position and would establish drug abuse resistance education funding and provide funding for such fund by annual transfers of state money. It is House Bill 2613 and is scheduled for a hearing on February 8th in the House Education Committee. And then the last bill I just want to highlight here is a bill that would require certain persons on a third or subsequent conviction of driving under the influence to participate in a multidisciplinary model of services for substance use disorders. And that bill did receive a hearing in the House Corrections and Juvenile Justice Committee on February 1st, and is scheduled to be worked tomorrow on February 6th in that committee. So in case some of those may be bills of interest to you, I just wanted to highlight them, but feel free to check those out as time allows. So with that, the next step for us in the process will be if the Social Work Compact bill does pass, then the next step it would be eligible to be worked on the floor for the House. And if it is worked in the chamber floor and passed, it would be assigned to a Senate committee. At that point, people will be advocating for it to receive a hearing. And if it is scheduled for a hearing, I would present testimony on behalf of the agency at that hearing in front of the Senate and answer questions. So with that, I'll go ahead and end my report and see if there's any questions on those items.
David, what was the bill number for that last bill you referenced on the third time DUI multidisciplinary team?
That bill was House Bill 2601.
Okay.
And that is in the House Corrections and Juvenile Justice Committee.
All right, thank you.
Sure.
Other questions for David? So I want to point out that he does this level of detail for every profession in our state. And every time you run through your executive director's report, I don't know how you do it all. So thank you for all of the work that you do.
Well, thank you. Happy to. And, you know, I want to make sure that you all are informed about these items. I know in the past there have been advisory committee members that have gone on to become board members in the future. So definitely appreciate your work volunteering on this committee, but I also know that as individuals become even further invested in these topics, you know, some of the people here could be future board members someday.
They matter. They're all important.
Happy to share the work that's going on right now.
Thank you.
I
Any
did have
other
one
questions?
question. Sorry, Laura.
No,
So
go ahead.
on the part where you mentioned the applications that could be evaluated, You said that there is a change where instead of the entire board having to review that there's like a limited number of folks that can review those to move that forward, or you guys were given permission, you and Leslie and so forth, like if something looks okay, you can just advance it without having to go back to the full board. Because I know that's been an issue, like we'll do a report, but then the board doesn't meet on it for a month or 2 months. And so then you might have a person that's ready to go, but it's just waiting for that next meeting. So just explain again to me. I just want to make sure I understand how that process is working now.
Sure. So ultimately, anyone who would have been potentially a denial would go in front of the board at a closed meeting under the Kansas Administrative Procedures Act, or the CAPA. And those meetings are held by the board once a month, usually on the fourth Tuesday. Isn't it an opportunity for us to have the board run through with legal counsel to see, is there a way that the board could find that these individuals have met the qualifications to move them forward, or does it have to be a denial with an official legal order? And for some of the individuals who have come from non-accredited schools, we've had to utilize experts for that process to have their program or education or both reviewed. And in the past, what we have done is if we ever had to have an expert involved, we would take that report and it would be added to the list of cases to be reviewed by the board under those CAPA meetings. But the board found that if we utilize an expert and based on the findings of that report, there's sufficient information for us to move forward without any further complications, then the board has delegated that that's something that BSRB staff, like myself or Leslie, we would be able to move forward on either licensing that person or giving them the ability to take the licensing examination without having to hold it just for the CAPA meeting for it to be reviewed. Now, if we get an expert report that says this person would not meet the qualifications, that's the opinion from the report, that would still have to go in front of the board because it's an issue. Or if, let's say, we had to have an expert review, but there was another conflicting item, like let's say past felony convictions, those require a specific number of board members to vote. And so those would have to be held for the board to review. But otherwise, if we are able to move it forward, we are able to do that. If we get an expert report and we don't think there's anything further as far as complicated items, the board has now delegated us to be able to move that forward without any further waiting. So.
Thank you.
Yeah, it'll just make it more efficient for a good number of our applicants that fall into that category. So I think that's going to be a good process change. Yeah. Any other questions for David? Okay, thank you, David Five, for your report. We move on to the updates from the multi-state compact meeting. David and I were in Tucson, Arizona for the AASCB meeting and Counseling Compact Commission meeting, which I attended. Most of the updates that I would provide were provided in David Five's Executive Director report. I will add, most of the time we spent at our Compact Commission meeting was on Compacts 101 and a presentation by Nahali Kalfas, who is the commission attorney. And we have a new executive director, Greg Searles, who was the executive director for the state of Wyoming for their licensing board. He is now the compact commissioner, or the executive director rather, for the compact. And he is going to be a great leader. We're very excited to have him. Compacts 101 just really stressed some of the basics that now that so many of the compact rules and regulations have been decided, it was just an opportunity to update everybody. One state requirement that we have that is relevant to the presentation that we had was, in order to be part of the compact, we have to require, the state has to require a national exam. So, that was reiterated because some states are considering changing what they require. Let's see, what else? The compact is not in effect yet. We anticipate that will be in late spring. And as soon as that happens, of course, it'll be posted on our website and we will certainly let you know as advisory committee members. I'm looking through my notes. I don't really see anything else. Oh, the compact attorney went into the differences between a universal licensure recognition law versus a compact, and really explained that ULR is just a one-way street allowing people into our state to practice, but it is not a reciprocal agreement. And so you know, that was just really the main difference in the two that was universal. What else? Can you think of anything else, David, that I should cover?
Just in terms of the compact, there was a recent decision by the Compact Commission. So I mentioned the compacts are requiring passage of a background check with fingerprinting.
Right.
And this is kind of being handled differently by some of the different compacts. For SIPAC, that is a requirement. And what they said is we're going to let states that don't currently require that have about 10 years to put that into place. But during that time frame, individuals who are licensed in those states would still be able to practice under the compact. For the professional counseling compact, they've taken a different position. And they've said, you know, if people pass this and their state doesn't currently require it, we're not going to kick those states out of the compact, but no one in that state will be able to practice unless they've done a background check with fingerprinting. And so we've started to explore, you know, the compact is not yet operational, but should it become operational quickly, we would hate for our licensees to be unable to utilize that compact. And so, so we were looking to see, okay, how quickly could we put something in place? We do currently have a statute that authorizes the BSRB to require background checks to be taken. We've also had conversations with members of the Kansas Bureau of Investigation in terms of how that process would work. It sounds like right now the cost for individual to do the background checks is probably about $48 per person, and that's not money that the BSRB would use for operations. That's purely for KBI to run that through their system and conduct the fingerprinting. But that would be an additional cost for individuals as part of, you know, being able to practice under the compact. But potentially what we've said is, you know, if the compact does become operational very quickly, potentially we could explore some temporary regulations that would require certain people to have to do this so that they could practice under the compact if they were interested in doing so. So that is something that's an added wrinkle in there too. And right now, before the compact becomes operational, we have time to really research things and figure out some options. But that is something that we've had some preliminary discussions on too.
Any questions about compact updates before we move on?
Looks like
I do,
Andrew has a
Laura.
question. Okay.
David, did the legislature resolve the issue that was talked about last legislative session surrounding the background check process? It got talked about in the House Health and Human Services Committee that was something that was holding physical therapy up from being able to engage in their compact process. So I didn't know. We had talked last year and it sounded as though that was going to be addressed, and Representative Landwehr had indicated she thought that was being taken up in a different committee, but I just don't know if did that ever get addressed. We don't have that potential issue there.
So I was part of a discussion with members of KBI about a possible bill that could be offered this session. I have not seen that bill, but I've been trying to take a look at it. But it's supposed to be for essentially the information obtained from background checks to make sure that it is confidential. I have heard that in terms of some of the mechanics that some other agencies have experienced issues with, we, I think, are in a better position. The bill that passed in 2016, they reviewed that language and they said that they believe that language is what is needed, that some of the other agencies don't have. They also said that there was something in place for us to move forward on that, some sort of a federal requirement. They said the BSRB was able to obtain after the passage of that statute. And so it sounds like some of the other maybe technical issues some of the other agencies were experiencing are a little bit different than what we would have. But in terms of the confidentiality, if there was anything extra to be added, I haven't seen that bill this session. So.
Yeah, I want to say it had something to do with the FBI wasn't recognizing KBI's system of how they were doing. So like the FBI has to approve each state's processes of some kind, and ours had something that the feds didn't like anymore, and so they were no longer going to grant us that unless we made some kind of change. So I didn't know if that had been addressed or was being addressed. So
okay, I'll reach back out to them on that topic and just see if there's anything, if we're part of the group that would have an issue with that, or It
Okay.
sounded like when they looked at the specific statutory language, it sounded like we had things in place that were maybe better than some of their individuals before. So.
Okay. Perfect. Thank you.
Any other questions for David? For me? Okay, our next item is info from the annual conference that David and I attended. So David, do you want to talk first or do you want me to go first?
You can go first if you'd like to.
Okay, so we attended AASCB in Tucson, Arizona. It was very cold. It was 22 degrees. It was colder there than it was here, which I was not a fan of. We were not prepared for that. One thing that really came through unofficially was how fortunate we are in Kansas to have the structure of our board and our advisory committees that we have. When I listen to how other states do it, they're so varied. Every state is different. And it just really made me appreciate how we are structured, what we accomplish, and that we have the executive director that we have. He is so well respected, asked to speak, asked to contribute. He has a very good reputation on a national level. So I just want to take an opportunity to say that out loud. Some of the breakout sessions that we had, I'll save AI for last. We talked about jurisprudence, and the jurisprudence conversation was very, very good. The states that have a jurisprudence exam talked about the importance of it, especially now that the compact is going to be in place, that we want people coming into our state to be able to understand our laws and our rules so that when they're practicing in our state, they can be mindful of how different it might be than their own state. And so that was one of the main emphases on a jurisprudence exam and the importance of it. The other emphasis was that most of the states that have a jurisprudence exam emphasize how some had data, most don't at this point, because some of these folks that were speaking about it were new at it. I'm thinking about Mississippi in particular, but we're both convinced that it definitely cuts down on violations, on problems in the state if it is required that you cover some of the rules that obviously we should all know. So those were some of the things that came from the jurisprudence discussion. The supervision breakout was also very good, talking about how each state does supervision differently. We've reached out to Tennessee. The state of Tennessee has a supervision handbook that they are willing to share. And so we've reached out to get that so we can just see how, what they give to anybody in their state who's a supervisor. I thought that would be helpful for us as we can continue our ongoing supervision discussion. The most interesting breakout I found was the AI breakout. It was really interesting to hear how we had a presentation from a person who does consulting to implement AI in the counseling world. And it was really interesting, the discussion about how AI is currently being used and the importance of being out in front of it in the counseling world. One state, I think it was Mississippi, uses a chat bot on their board website, and that chat bot last year answered 30,000 questions that a person didn't have to answer. And so I thought that was interesting. But the main thing was just really understanding the interaction of AI because it's coming and the relevance of AI currently in the mental health field. So that was interesting. Left a lot to think about. David, anything else you want to add from our conference?
Yeah, so and I appreciate the compliments, Laura. I was a member of a committee for AASCB last year, and that was a bylaw committee. They were trying to go through their bylaws and make suggested changes. And I was not the chair of that committee, but through a weird set of circumstances, one member was unable to attend the conference and another changed roles, so really wasn't the best person to speak. And so I was asked to go ahead and deliver the summary. So I did that for the members, and that went well. In terms of the topics that were covered, yeah, AI is an interesting topic. So basically, it sounds like a lot of the associations, or specifically the AASCB association, wants to help state licensing boards get out in front of that topic. But as part of that, there needs to be some understanding of what the AI tools are. One of the best ways to address the topic of AI may be through the unprofessional conduct regulations for states. But one thing that we talked about towards the end of the conference was, if you put this into the unprofessional conduct regulation, where it's really going to come into play is if someone files a complaint, and then you have a subset of the board who's being asked to evaluate now whether there was a violation involved with AI. And so you're kind of asking board members who are part of that process to now have to become somewhat experts, at least to a limited degree, on AI. And so, so part of this is a changing field, and knowing what to put in place to help people understand, but also, making sure that we as a licensing board can get a handle on it too, to be able to evaluate any kind of complaints that would involve things like that. One topic I also thought was kind of interesting. One of the discussions had to do with discipline and complaints in different jurisdictions. And one of the items they put on the screen was they collected information on sorting complaints into different categories. And the number one category of complaints and violation was CE requirements. And I found that to be kind of interesting. Not that CEs are not important, but if you do have limited resources in terms of investigations and discipline, if you do have that many that are taking up that much time of your staff, perhaps there are better solutions, which is one of the reasons I think that the board is interested in CE broker, essentially to deal with issues about CE compliance. Now, the second item on that list was dual relationships. And when you talk to the members of the legislature, they want to get a good grasp on, what individuals are being harmed with these complaints versus more technical violations. And so knowing at the national level that, at least from the trends that they've been picking up, the second most common violation are dual relationships, that is concerning and problematic. And so you want to make sure that we are protecting the public. And so hopefully, there are ways to go ahead and address that. And there do continue to be individuals practicing without a license. That's another common item as well. And while some of that may be individuals who just continue to practice without being licensed at all, some other individuals may just not be as timely in making sure they do their renewal, yet continue to practice. And so some of that might be addressed with more awareness. And so as I heard this information, I was thinking, okay, how can we as a licensing board be helpful in some of these areas? And what is it really that's on the practitioner's responsibility? So the jurisprudence conversation, I think, is a very valuable one to have. When we talk about individuals practicing in different states, some individuals want to open it up and say, this is great, now I can practice in 30 different states. But if you don't know the differences between what you can and can't do in that state, or what you should and shouldn't do, as an attorney, I couldn't imagine trying to practice law in 30 different states and being competent on all the rules and requirements in those 30 different states. But I know that there can be a temptation to say, if it's provided this new opportunity, I want to take advantage of that. So I think maybe there are things to explore, like a jurisprudence exam, to make sure that we're making sure the people that are providing services to citizens who are located in Kansas, that they really have shown that they are knowledgeable about what we require here in Kansas and what our rules are here in Kansas. So something for us to look at and kind of weigh in terms of some of those factors. Supervision was a topic where it was talked about as well. Supervision is tricky because there's not a great deal of uniformity between states. And I think a lot of states are trying to tackle it from different angles all at the same time. And I'm hopeful that between the different professions we regulate, we can kind of find more similarities in other states, or we can learn from each other in terms of best practices. There were some states that talked about having to submit supervision during the entire process, that individuals accrue hours, which would have to be a pretty robust system to be able to do that. It would also be a lot more requirements on people that are either providing that supervision or people obtaining it. Some individuals just open it up and allow for individuals to collect supervision from anybody who might meet the qualifications, which means that you have possibly as many as 25 to 30 different individuals providing supervision at the same time to the same person, which creates some issues with that as well. So there are lots of models from different states, but there's also pros and cons with all those models as well. So we're trying to have a good conversation and learn what's working and what's not. And I think that conversation on supervision will continue more this year as well.
Awesome. Thank you so much. Anything else you want to add, David? Bye.
No, I think the next opportunity we will have to interact with individuals will be in June at the National Conference for the National Board for Certified Counselors. So don't know what's going to be on their agenda for that conference, but they just sent out a notice about it recently. So we'll be continuing to work with representatives from AASCB. We generally have a monthly little 1-hour forum where board members and I as an executive director can have just short conversations on topics with them. But in terms of a formal meeting, the next one coming up will probably be that one in June.
There we go. Great. Thank you so much for that update. Anybody else have any questions?
Looks like Andrew has his hand up.
Andrew.
I do. Yeah, you guys have probably missed me over the last semester, haven't you? All the questions. Just quickly on the jurisprudence exam, is this something that's going to be required only for people that are outside of Kansas, or are we saying this is going to be a requirement in general for licensure? So we're going to have Kansas licensed folks take the exam as well as people that are trying to be part of the compact, or is it just people from outside Kansas who are applying through the compact are required to take a jurisprudence exam?
I think the way that it's set up in different states that require a jurisprudence exam is it's set up as a requirement for anyone to obtain licensure. And so for those who obtain licensure within the state, they have to pass this as well. For those that would be part of a compact, some of the compacts do say, you know, we're not going to make you get CE hours in all these areas, but the jurisprudence topic has been something that a lot of the compacts have said, if your jurisdiction does have one of these, we can still require people to pass it if they're going to practice in that state.
That's how I understand jurisprudence exams too. I just wasn't sure exactly how we were setting. Now, will that require all currently licensed people to then take a jurisprudence exam, or are we just saying people that are part of the compact and new licensees would have to take one, or are we gonna grandfather in existing practitioners? Do we know? Because I imagine people will start to wonder about that. Like if we're saying we're going to start testing people, I didn't know if that had been thought far enough ahead to answer that question or not.
And Laura, feel free to add anything on this discussion too, but I think we're just kind of at the entry level. I think there's been some conversation by board members in the past about, you know, does Kansas have a jurisprudence exam? Since we don't, should Kansas have one? And so that's kind of, you know, we're basically a step past there, just looking to see, should we have one? The board really hasn't had a conversation about looking back to say, should people who are already licensed be required to take it, or should it just be a new requirement for people as of a certain date? And so I think those conversations are very important, but I don't think we're kind of there yet. So.
We've just started. Yeah. Great question. Thank you for asking. Anyone else? Okay, we are ready for old and new business. So David, I'm going to have you handle this one. Continued discussion on examination for clinical license.
Yeah, and basically we wanted to make sure we kept this on the agenda. We had the presenters who gave information on the examination today, and there were some good questions that came up after that presentation. So probably it'd be best to go ahead and table this item till the next meeting. Wanted you to give a chance to digest what you heard, maybe do some follow-up research on your own concerning the examinations, but you have already talked about the exams in the past, and now you have a little bit of feedback from those individuals who presented today. So that's kind of why this topic was on the agenda today.
So we'll move it down to our next meeting. This is an opportunity for me to say to all the educators on this advisory committee, also known as most of you, I hope you're proud of having sending students out into the world with a 15% point higher test passing rate than the national average. That, in my opinion, is a clear reflection on how they're being educated in the state. So I hope you're proud of that.
Yeah, that was an interesting comment. Interesting fact.
Yeah.
Yeah, I was surprised to see that as well.
Pretty impressive.
Certainly.
Yeah. You guys ought to, I hope you share that data. It's good to know. Well, let's move to some new business. So the first one is a jurisprudence exam. We were talking about it. Does anybody have any feedback or questions or anything to add to the conversation as we begin the process of creating a jurisprudence exam?
I think it's a good idea. I think when I got into the field, I was told not knowing's not a defense if I do something I'm not supposed to do. And we expect in our documentation, we say you understand and know the rules and the laws and regulations or statutes, regulations and such. I mean, it seems like another way to make sure that people are informed, especially for people coming outside the state.
Right.
So I don't think it's a bad conversation to have. Where we end up, I don't know, but I think it's worth a conversation, a serious conversation.
Thank you for that. Anybody else?
I agree with Andrew. I think the idea of someone who's been in numerous states and have to go through the process of licensure. I know that knowing the regulations is important. Knowing the law is important, so I don't think that I don't have any opposition to that, and I'm in favor of having that because people need to learn where they're going to be working at. So.
Right. Thank you for that.
To assist the work of the advisory committee on this topic, I will try to reach back out to maybe NBCC to see if they have any data on how many states currently require passage of a jurisprudence exam. That might be helpful information to know too if we are an outlier and most states do require it. So I'll try to get some kind of information for context on that as well.
ACA should have that information as well, by the way.
Okay. Thank you.
Yeah. Anyone else? The NBC. Oh, go ahead.
I was going to say, as we're doing this, I imagine thinking about the potential effect on the board, the staffing and so forth. Like, do we anticipate jurisprudence exam having any kind of substantial effect on you all?
So I have heard of a model, and maybe Laura, you've heard some different types of models, but it seems like there are some that that function as a learning tool. That when you take the jurisprudence exam, it's not so much meant as a disqualifier. It's more of a way that if you're going through, it educates you. And so if that would be the type of model that would be used, I think we would just know that people had completed it and had satisfactorily, gone through the steps to make sure they were knowing the information versus something that we would have to score on our end. That would make a big difference in terms of responsibilities for staff.
The NBCC has offered to help us develop the test. They've done that for a number of other states. And one model that they said has become quite popular is an informational test, meaning that there are a certain number of questions. We can have input, of course, on the questions, and that you keep taking the test until you pass all of them. It's a pass-fail test, and that they recommend that we devise a test that's based on two things. One, what are the problems that show up in our state? What are some of the consistent trends that we really want to reinforce the statutes and regs with? And the other thing is, well, that's the main one, but the other one is, what are the uniquenesses of our own state statutes and regs in comparison to other states? We want to highlight some of those things so that when someone is coming in from another state, they really know that this is an important difference. And so when you pass that test, when you take the jurisprudence, you will be taking it until you get all those questions right. And so it's really, as David said, a learning tool.
Thank you.
Thank you. Any other questions about jurisprudence at this point? Okay, well, we will keep you updated as things develop and be asking for your ongoing input about this. It's an important step, and I think it's going to really make a difference in, the quality of what people are aware of when they come into our state, and for folks that are currently licensed. So thank you for the ongoing discussion that will take place this year. The second item for new business is discussion on supervision. David Fye, do you want to go ahead and lead that one?
Sure. As I mentioned, there are lots of models on supervision, and we certainly have discussed the model here in Kansas and try to provide a little bit of context for what other people in other states are doing. Also, over the last few years, some things have opened up because of the pandemic and just the shift in technology in terms of doing supervision by in person compared to by screen or televideo. And I mentioned the survey for social workers, that there is currently an active survey, and that your advisory committee could request a survey as well. So this is maybe a topic to be thinking about for the future, if that's something that you want to explore. And in terms of survey questions, if you have thoughts about looking at any issues that have come up, either hearing from people who've received the supervision or people who provided the supervision, maybe even if there has been an uptick in people providing supervision by televideo. The board, when they had the discussions to go ahead and try to open that up, someone brought up an interesting point of, how much is this actually being utilized? Because the board wanted to make sure this was in place to help people, but if people aren't really using this, is it helping people, or has it been widely adopted and it's been a success? So that's something to be thinking about. And we'll try to bring back some other information about what other states are looking at in terms of this area too. We're trying to go through our regulations for each of the professions, and we talked a little bit about approved clinical training plans and the 45-hour requirements, but supervision in general is definitely a topic for the advisory committee to take another look at this year as well. So.
Thank you, David. Any feedback about the supervision conversation?
I would just say it's created a lot of flexibility. A lot of my supervisees will come in person, but then there's lots of times because of work, they do virtual, and it just works into people's days better. Employers are much more flexible with them when they don't have to leave to go somewhere and come back. They can just give them an hour at work to do supervision and such. So I've seen a pretty broad application of it, creating a high flex kind of educational model in some sense. So yeah, it's been used a lot on my end and from people that I know. The virtual side.
Thank you for that. Anyone else? Okay, as we have more tools available to us, we'll share them with you. I'm looking for any feedback we can have about supervision on many different levels, and we'll kind of put that's going to be an ongoing conversation, so it'll keep coming up on our agenda. David, do we have time for 102-3-3A?
No, but that's okay. This meeting, we had some guest speakers that were presenting information on the exam, and this next topic was probably a good one to discuss at the next meeting. We had talked a little bit about even reaching out to representatives from the national accrediting body, KCREP, to see if they can provide any comment on our education regulation. Not that we need to do whatever KCREP would require, but our current regulation does indicate that there is a pathway from individuals who receive their education from a program that is accredited by the national accrediting body. And then alternatively, if you didn't receive your education from a program that is accredited by them, or have, consistent standards with what KCREP would require, they have these alternate requirements in the regulation. And one thing I'd like the advisory committee to be ready to do at the next meeting would be to look through the requirements listed in KAR 102-3-3A, specifically items F and items G, that deals with the program level requirements. But basically, like the advisory committee to have a good discussion on if these current requirements really do match the standards for what would needed to be in place for someone to meet the qualifications for licensure if they came from a non-accredited school. If someone came from a accredited school, these are really not at issue. But also looking at it from even a deeper angle, the board is put into a position that if someone does not meet these requirements, the board really is asked to deny these people for licensure. So for each one of these current requirements, I guess the other question would be, is that still suitable that if someone does not meet each of these requirements, would that be sufficient reason to deny that person for licensure? And that kind of hopefully carries some weight to it for each one of these things. And Leslie Allen is the Assistant Director, Licensing Manager for the agency. She's more familiar with some of these regulations, specifically maybe when they were originally drafted or modified in the past. And so I had asked her to kind of be ready to kind of walk the advisory committee through these and to have more of a discussion, but since we're almost out of time, Leslie, do you have anything you want to add as far as something for the members to be thinking about when they review these in preparations for the next meeting?
No, I don't think so. I
Okay.
think you did a good job explaining it.
Okay. Well, yeah, specifically sections F and sections G. And if you could just take a look at each one of those requirements and be thinking about it right now, if someone comes from a non-accredited school, when we evaluate their program level requirements, their education, if they don't have each of those items that are fulfilled, each of those is a disqualifier for someone meeting the requirements for licensure. And so just review those and be thinking, yes, this may be beneficial, but is this so important that it needs to be a requirement for licensure? And I think that's a good lens to kind of be looking at those.
Excellent. Okay, all the educators have homework.
And you said F and which one?
G.
G.
David, would it be okay? Is it okay for me to share a little bit about, not talk a long time, but just mention a comment because of some of the reviews that I do? Am I able to talk about that here? I'm not talking about anybody specific, just the general.
No, I think it's
Okay.
fine to just give broad commentary because, yeah, you've
Yep.
been an individual who's had some extensive experience reviewing those regulations.
Yeah. So this is something that I just want to throw this out there as we do our work for the next couple of months. So having done some of these reviews, I've both reviewed and recommended people for and not for licensure based on some of these. And some of the issues that we've come up with have been, in many cases, have been who the department chair is. And that's one of the areas where we're looking at this, is that if their department chair doesn't have a degree in counseling, they technically don't meet our regulations. So therefore that person could meet all other areas, but be disqualified as a result of not having that person with counseling. And so we're looking at some of these different things about like that, and then the distance part, like the residency process was some for online programs at one point in time too. I don't know if that's still an issue, but that was one area where if they were taking a non-KCREP accredited online program, that they weren't able to be licensed in Kansas because we have a 30-hour residency requirement. At least we did. I think we may still have that for non-KCREP accredited programs. But the not below the KCREP standard is a challenge. That's something we've come up with some standards to kind of go by, but there's been some discussion that should we just have they meet it or they don't? And then we just run them through our normal process, which would be through then the regulations that we're being asked to look at. So we just say either you came from an accredited program, so therefore you meet, or you didn't come from an accredited program. So then we just run you through our general process versus us having to go through deciding what KCREP, not being below KCREP standards is, since there's a lot that goes into that. So because we have that there, we've developed some criteria to look at to make those decisions, but it could be helpful just to kind of you meet or you don't, and then we just have our two processes. So just to throw that out there to think about, having been on the other end of doing the reviews, about how this could be helpful at ensuring people that are qualified get licensed. And that also we have a good way of looking at how we move people through that process too.
Yeah, thank you, Andrew. I appreciate you mentioning that because we did kind of touch on that at the last advisory committee meeting, just the very end of that meeting, as one of the reasons why it's going to be helpful to review this regulation. And I think if we can reach out to representatives from KCREP, and I'll try to do that and see if they can provide any comment maybe on our regulation. Because as you mentioned, there is sort of a third path. There is individuals who attended a KCREP accredited school. There's individuals who did not and are trying to meet our alternative requirements. And then there are individuals who attended a school that's not KCREP accredited, but their program asserts that they are not below KCREP standards. And then it puts us in a weird position of trying to do things that a nationally accredited body would be doing and trying to evaluate how they interpret some of their requirements, which is a very difficult thing to do. So I think if we can take a lens of looking at our alternative requirements, and if we can be sure that some of those don't go above what KCREP would require, then I think it would be an appropriate time to modify that language. And instead of it having that third pathway, it can be matching more of the other professions. And so one of the proposed changes could say either you came from an accredited KCREP accredited program or you meet the requirements in licensure, which is language that is more consistent with what we talk about for the APA for psychology and the accredited body for marriage and family therapy and for social work, I believe, too. So I think getting that matching would be a helpful change as part of this process too. So appreciate you spotlighting that.
Definitely. Okay, so we are wrapping up because we're out of time. We didn't get to new topics for 2024, but I will say it sounds like a survey is probably a new topic item. Safe to say? Let's make sure and really focus on new topics for 2024 in our next meeting and know that, even though that means a third of the year is over, that doesn't mean we don't have work to do that we can do and it can roll over into next year. So does anybody have any other additional topics they can throw out real quick if you have any? And if not, we're definitely going to focus on it next meeting. Okay. Our next meeting is April 1st, 2024, 10 a.m. Do I need a motion for adjournment? I can never remember.
I move that we adjourn.
So the answer is yes. Thank you, Bob. I need a second.
Second. This is Andrew.
Thank you, Andrew. Okay. All in favor, say aye.
Aye.
I doubt I'm going to hear any opposed. Okay, we will adjourn. Thank you so much for your time today.
Thanks, everyone.
Thank you.
Thank you.
Thank you. Take care.